So what does the coronavirus outbreak mean for Africa? Well, the Africa Center for Disease Control has warned that the novel coronavirus presents a unique public health threat to the continent. Speaking to Citizen TV, Africa CDC's Deputy Director, that's Dr. Ahmed Ouma, maintained that even though most countries have enhanced surveillance and screening, local healthcare systems unfortunately remain fragile and cannot sufficiently handle a fast-spreading and highly contagious disease like the COVID-19. Enoch Sekolia reports.
Despite having multiple direct flights to China, the epicenter of the coronavirus, only 6 countries in Africa have confirmed cases of the COVID-19.
We do not have any vaccine.
Dr. Ahmed Ouma, the Deputy Director of the Africa Centers for Disease Control and Prevention, Africa CDC, spoke to Citizen TV about the risk posed by coronavirus to African countries and Kenya in particular. Ouma and his colleagues have been working on a diagnostics and containment strategy to combat the disease. And he says 2 immediate dangers facing the continent now is the ability to detect quickly and the ability to contain the virus.
All countries in Africa, the health systems are relatively weak. And weak health systems get overwhelmed very fast when you have a disease that is as contagious as this COVID-19 is. This means that to avoid a scenario where you have many cases in a country, you want to always be ahead of the disease by ensuring very early identification of a case. That means the surveillance must be very high.
He says failure to pick out infected people quickly means they will keep on mingling in the population, spreading the virus more. He says besides screening other points of entry, creating public awareness of how the disease spreads and how to stop it at an individual level should be given priority.
Because incorrect information is actually the biggest problem now, much bigger than the virus, because it ensures that you cannot be able to get correct information, and it ensures that you get into panic mode. So avoid crowded places, wash your hands or use a sanitizer, and when someone is unwell, then you ensure that you get seen quickly. Many people have started wearing masks, but allow me to say that the mask is the least effective method of protecting yourself when you are not unwell. The surface that may have the virus having touched by someone who has it will not be on your nose, will not be on your mouth, it will be on your hand. And your hand touching your mouth, your nose, or your eye will transfer the virus into your body. So the mask is encouraged for those who are unwell to stop them from spreading it to others.
He says even though the virus is mild, Africa should be concerned with how the disease manifests itself. He says with the virus spreading quickly, the continent might find itself struggling to contain it.
The health systems in Africa still have a long way to go. And we at Africa CDC are urging governments to strengthen their health systems, to ensure that we have facilities that can be able to manage these conditions, to ensure that the health workers have the right training and information to be able to manage those cases, to ensure that the public are aware how to prevent and how to protect themselves.
Ouma says Kenya, like many African states, should work hard to stop this virus in its tracks everywhere. Enoch Sekolia, Citizen TV, Nairobi.